For you personally, what are your favorite procedures, high-level procedures to perform?
That's a bit tricky. I'm not sure there are low-level procedures.
How is Dukes trying to reduce the need for medical tourism?
I often say that you cannot eliminate medical tourism because as a people, you have a choice to decide where you want to be taken care of and where your trust resides. There has been an inherent disbelief of the Nigerian population in the quality of healthcare delivery in Nigeria. But I must tell you that the perspective is changing. Most of us and our friends, they are coming back into Nigeria to establish world-class standard. I'll tell you that we've done a whole lot of successful surgery, possibly put it as now as more than 1,000. As at the last count, Duke's Neurosurgery and Specialist Hospital has about 43 full-time and local consultants in different subspecialties of medicine. One thing most of my patients have also told me in recent times is that even when they go outside the country, for them to have excellent healthcare delivered to them, they end up meeting a Nigerian. As a surgeon, if I can remember well, minimum I've operated about 3 or 4 people that was flown in from Liberia into Nigeria to be operated, and they are fine, they are back to their country and doing well, and some other African countries. That is where Duke's Neurosurgery and Specialist Hospital come in. The first level of healthcare delivery is actually health education. By the time you are able to educate people, less number of people fall sick, and the capital flight into healthcare delivery is reduced.
Hello everyone, you're welcome to our very first episode of Health Conversation with Dukes. I'm Dr. Kanu Precious, your host for today, and with me is...
I'm Mr. David.
Our show is an educative podcast aimed at delivering information about healthcare involving neurological care. Now, often when people hear the word neurosurgery, fear is often the first reaction. The fear of the unknown, the fear of risk, and the fear of what the outcome could possibly be. But today, neurosurgery is changing with advanced technologies in place and a patient-centered approach, which is aimed at replacing this fear with hope.
Our topic for today is bringing hope through patient-centered neurological care. And in this episode, we're going to be exploring how putting the patient at the center of neurological care helps in improving possibilities. And with us today, our guest today is Dr. Festus Oshunpidan, and he's a consultant neurosurgeon. Dr. Festus, nice to have you here with us today.
Thank you very much. Okay, so thank you, the anchors of this program. And it's a good thing for us to have opportunity to speak to the people about what is possible and how Duke's Neurosurgery and Specialist Hospital is actually increasing the boundaries of what is possible in healthcare delivery. So it's the opportunity that we think we have to tell the people about what is not possible in the Nigerian healthcare system and how rapidly we're trying to reverse health tourism and probably move to the extent of even attracting tourism to the Nigerian healthcare landscape. Thank you.
All right, sir. You were speaking about health tourism. Now, speaking of health tourism, I want to ask you this. What inspired your vision for creating your hospital to becoming a center of excellence in the field of neurology and neurosurgery, especially in our region today?
Oh, okay. So thank you for your question. Okay, so over the years, it's been observed that there is actually scarcity of available specialist care in the Nigerian healthcare landscape. And that has led to several people going outside the shores of this country to seek specialist intervention in healthcare problems. And more often than not, when our people get outside the shores of the country, they meet Nigerians that have been trained both home and abroad, attending to them for care. So this creation of Duke's Neurosurgery and Specialist Hospital as a multi-specialist hospital is based on the desire to make super specialist care available to Nigerians at affordable rates, cutting down the time and the queues that all they face outside the shores of this country in accessing quality health care. And even though Duke's Neurosurgery and Specialist Hospital attends to other cases, other patient conditions, other health-related conditions, However, we are renowned as Center of Excellence for modern practice of neurology, neurosurgery, and neurorehabilitation. And over the years, we've tried to ensure that we increase our presence both in terms of human capital development, in skills acquisition, and of course, acquisition of modern equipment that will ensure safe and good outcome of patient care. I hope I answered your question.
Yes, sir. And then you said something about neurosurgery. I'm hammering on that because I'm very interested in that topic as regards to us in Nigeria. Now, your center is known for performing several high-level procedures when it comes to neurosurgery. Now, for you personally, what are your favorite procedures, high-level procedures to perform?
Yeah, so that's a bit tricky, but I'm sure that I'm not sure there are low-level procedures, but of course, especially when you talk about neurosurgery, but that can bring about what I've repeatedly termed the evolution of neurosurgical practice in the country. Because over time, neurosurgery had started in this country for a long time, and credits and kudos to the fathers and founding fathers of neurosurgery in this country that actually established the practice, and through every drop of sweat, they've grown it over the years by training some of us, even before we now have opportunity to have some training outside the shores of the country. But neurosurgical evolution comes hand in hand with increasing skills and increasing availability of high-end equipment to ensure safe surgery. Maybe I would say that where Duke's Neurosurgery and Specialist Hospital is coming in is the ability of the hospital to combine the high-end skills, both learned both home and abroad, with the availability of high-end neurosurgical equipment to ensure safety and quality healthcare delivery to our patients. So in terms of the surgeries that we've done wide range of neurosurgical procedures. Like I always tell my patients, there are possibly no simple procedures. When you say somebody is a neurosurgeon, you talk about the person dealing with issues of brain and spine. Okay, so starting from simple quote and unquote spine decompression for patients that are having difficulty walking, recurrent low back pain going through their legs, people having difficulty writing, people having difficulty carrying out simple tasks with their hands. Some of our whole populations will come to you in the clinic and say, oh, they are complaining in the banks now that my signature is changing or my handwriting is not regular again. So some sort of degenerative spine disease. Those are some of the surgeries that we have carried out and with good patient outcomes. Sometimes these patients with degenerative spine disease tend to also have some form of instabilities, so and we can also fix the spine, and those are some of the things we've done. Talking about the interventions in brain pathology, brain diseases, that's what we mean by pathology, ranging from blood in the brain, compressing the brain, outside the substance of the brain or inside the substance of the brain, or brain tumors of different types, either in the different locations inside the skull, to aneurysms. It used to be a death sentence that anybody that has a dilation of the blood vessels in the brain is a death sentence. But now, a lot of it have been done by us at Dukes and some of our colleagues even outside Dukes. So, neurosurgery practice has come of age in the country and is daily improving. But at Duke's Neurosurgery and Specialist Hospital, we're trying to take it to a new height by ensuring that the level of skills that our neurosurgeons have, fortunately I'm not the only neurosurgeon at Duke's, it's a clinical consortium of so many other neurosurgeons that are really, really doing well, and they have a lot of good clinical skills and surgical skills to deliver the very best to the patient. So by and large, I'll tell you that we've done a whole lot of successful surgery. You possibly put it at now as more than 1,000 surgeries that we have done in the time of existence of Dukes with very laudable outcomes. Okay.
Amazing, amazing. My co-host, would you like to add one or two?
Yes, so we've been talking about neurosurgical cases. Now at Zooks, do you only offer neurosurgical care?
Yeah, so that's a very good question. Patient care cannot be done in isolation. You know, if you have a patient that is possibly going for a brain tumor surgery, either if we want to do endoscopic surgery, endoscopic brain surgery, which we are really renowned for at Dukes, removing brain tumors through narrow opening, either through the nose or through endoscopes, or you want to do open surgery that you possibly use operating microscope for. Sometimes these patients have other comorbidities, you know. So when you talk about comorbidities, you talk about somebody that has diabetes, you talk about somebody that has hypertension, and for safety of the surgery and good outcome, you need to possibly control some of these comorbidities, and that is why the hospital is a multi-specialist hospital. But we always say it and we act it, and that is what we do, that it is a strictly consultant-led service. Okay, as at the last count, Duke's Neurosurgery and Specialist Hospital has about 43 full-time and locum consultants in different subspecialties of medicine, you know, including cardiology. We do a lot of tests also to ensure fitness of patient for anesthesia, pulmonology, you know, nephrology, because sometimes, because the hospital that is doing so much in neurosurgical intervention must have a state-of-the-art intensive care unit, because care in neurosurgery is pari so with state-of-the-art intensive care unit, you know. So, and every intensive care unit should be supported by your ability to dialyze patients in case they enter into some, they have some possible underlying pathologies or acute complications, like you talk about acute kidney injury. So the hospital also has a dialysis center, you know, and we have a standby nephrologist that coordinate the activities. Besides all these other support specialties that we have that are on ground, that are reachable, we have other surgical subspecialties, you know. We are known to be a center where we have a lot of orthopedic surgeons that also are super specialized to help with different aspects of orthopedic surgeries, including knee replacement, hip replacement, fixing of fractures, and congenital anomalies. Okay. Our ear, nose, and throat surgeons, they treat from simple to complex conditions, including endoscopic sinus surgeries, you know. So we're actually trying to take the care of medicine, the care of patients, above what people believe should be the pedestal for Nigerian standard. Okay, and that has been part of the driving vision and driving force of the hospital to ensure that it is not just what people think Nigeria should be able to do, and outside this you should go outside the country. No. So the goal is attract. Let other people also leave their country and be able to come to you and enjoy the same multi-specialist care that you can enjoy practically anywhere in the world. So, of course, other subspecialties like the vascular and interventional cardiologists, like cardiothoracic surgeons, they are available in Dukes, and they are good support system that make our patients have very, very, very fantastic outcome. Yeah, thank you.
Oh, okay. Talking about medical tourism, we often have people say they prefer flying out their relatives abroad for better healthcare because they have this impression that healthcare abroad is better than in Nigeria. How is Dukes trying to reduce the need for medical tourism for people?
Oh, okay. So that's the question I often love to answer when it's thrown to me. I often say that you cannot eliminate medical tourism. Okay, because as a people, you have a choice to decide where you want to be taken care of and where your trust resides. So, but what we have seen in Nigeria over the years is because there has been an inherent disbelief, of Nigerian population in the quality of healthcare delivery in Nigeria. But I must tell you that the perspective is changing. Most of us and our friends, they are coming back into Nigeria to establish world-class standard. One thing most of my patients have also told me in recent time is that even when they go outside the country and for them to have excellent healthcare delivered to them, they end up meeting a Nigerian. Yeah, so, and then that is gradually boosting their faith in the fact that it simply means that if these same Nigerians that they are meeting outside the country have access to the same quality of equipment that are possibly available outside the country, they will possibly do the same delivery of healthcare, if not even more. And that is where Duke's Neurosurgery and Specialist Hospital come in. You have specialists that are both locally and internationally trained, worked in different parts of the world, had high level of skills, and then that is complemented by the fact that the management of Duke's Neurosurgery and Specialist Hospital is investing heavily into modern equipment to increase safety of intervention and good healthcare outcome. So if you ask me, where is Duke's Neurosurgery coming in this? It is in massive investment in acquiring high-level modern equipment that will increase the safety of patient care intervention. And gradually we are seeing the result. A lot of patients that hitherto will have jumped on the next flight to outside the country, they have now decided to seek healthcare in this country, and they have remarkable testimony of a very good outcome of their care. And that's not enough. As a surgeon, if I can remember well, minimum I've operated about 3 or 4 people that was flown in from Liberia into Nigeria to be operated, and they are fine, they are back to their country and doing well, and some other African countries. So people are also now seeing Nigeria as a center where you can move and come to. I remember there was a gentleman that had some issues with his health somewhere in Liberia, and a friend reached out to me that he wants to fly down to Nigeria to come and have his care done. He came to Nigeria, he was treated, was fine, and he has since gone back to his country and enjoying his life. Okay, so the target of Duke's Neurosurgery and Specialist Hospital is actually beyond talking about reversing net tourism alone. We think that is a primary level. The secondary level and the tertiary level that we are hoping to get to and consolidate on is actually in attracting tourism. So, because there is no how you can completely stop people from moving outside the country. It's just like when people talk about, Nigerians they don't have enough specialists, and so that is why people are doing this or doing that. I tell them, everywhere in the world, in the States, in Europe, in India, in Asia, you have people move from different parts of the world to different countries as specialists. You have people that are from India, from Mexico, working in the States as a consultant. So there is nothing stopping us also from having people from Canada, from Mexico, from US, from England, coming here to come and work. Okay, so the perspective has to be clear, or the goal has to be well defined. You can't stop health tourism, but you can build up your health system in such a way that you can attract tourism too. And that is where Duke's coming. Okay, thank you.
All right, so that's amazing to hear, sir. And I'm sure our viewers and listeners at home would also like to hear my next question. And my next question revolves around, what efforts has your hospital made over the years in enlightening us in the Nigerian society, enlightening the Nigerian society about the importance of regular checks regarding our neurology, now our neurological system per se, now our brain, our spine, what efforts has your hospital, Duke's Neurosurgery and Specialist Hospital, made over the years to be able to
Okay.
enlighten and educate us?
Yeah, that's, you see, the first level of healthcare delivery is actually health education. Because by the time you are able to educate people, less number of people fall sick, and the capital flight into healthcare delivery is reduced. Okay, so that is one of the reasons why we are having this podcast coming up. Okay, because oftentimes we get to see people in the consulting room presenting very late to us because they actually don't understand or identify the symptoms and the early warning signs of particular disease condition that will have been picked up earlier and then could have been sorted. Is it jokingly, I was in a place sometimes last year, uh, outside the shores of this country. So we were discussing and sharing images amongst ourselves in Pittsburgh, and you know, there was a patient that they were talking about surgery for with a brain tumor, what we call pituitary tumor, tiny brain tumor, and everybody is talking about the approach. So I stood up and I told them, I said, we don't see this kind of tumor in Nigeria because this is too tiny to come to the hospital. That the ones you will see in Nigeria are the ones that look like yam in people's edge. And you see, that perfectly describes the place of health education.
Yes.
Yes.
Okay, because an average Westerners, immediately you discover you start having blurry vision, you see narrowing of your visual field, you start having recurrent headaches. The next thing you want to do is to jump to the hospital because insurance is working, there are some healthcare benefits, and then you get tested and somebody tells you, oh, you have this tiny size tumor, let's then remove it. Okay, and then there is also constant education on when you have these symptoms, you should go to the hospital. Okay, so which is not what we have here. So why our podcast is coming on is for us to encourage the population to listen to us. Okay, when in the follow-up series, we'll be talking about specific symptoms of some of these neurological conditions, some of back problems. Because you see, we've seen a lot of patients that people will think it is stroke they are having when it's actually a brain tumor or it's just blood collection in the brain. And the management is totally different. But of course, because the idea of the symptoms, understanding of the symptoms, and all that. So what we're trying to do now is we keep talking to the population. Like I mentioned in my first statement of response, the first level of healthcare delivery is actually in health education. Okay, so we are ready and we are willing to go all out to talk to our listeners, to let them understand the fact that when you have this symptom, come to the hospital. Because intervention at level of early presentation is better, outcome is also better, complication is less. Okay, so but we see that one of the major problems with our patients here is the fact that they don't even understand what is happening. People don't read about their symptoms. And some of our doctors in some corners of the country also feel agitated and feel quote and unquote assaulted when the patient says, I've read about my symptoms. But we see, I tell people, I said, when I relate with patients, my patients in the Western world, we discuss like we are professional colleagues because they've read about the new trials, they've read about the new medications that are available. So when you are discussing with them, you are discussing with them about, okay, so you know about that side effect, so we can use this also, but the problem is this. Oh, they talk about the name of their doctors. But it is here that we discover that even some of our doctors, they don't want their patients to know their name. So your doctors should know your name. They should know you with your first name and your last name. They should know your subspecialty. That builds confidence in them. So in our series, as we come up with this, we'll take more time to have a lot of educative series when we talk about recognizing early symptoms of brain spine issues and other medical conditions and where you can present. It doesn't necessarily mean that you should come to Duke's, because the purpose of this is for you to present early so that you can have a good outcome. Of course, if you decide to come to Duke's, you can be rest assured that we have raised the bar of healthcare delivery, and they are going to participate and benefit from the same. Okay.
All right, sir. Speaking of raising the bar, now for a facility like your facility that is a specialist hospital that is also involved in neurosurgery, and you have gone and achieved so much and gone so far in the field, have there been any peculiar collaborations, private collaborations, private public collaborations that you like to hammer on, you like to express gratitude towards, or you like to even shed some light on how these particular collaborations are important in delivery of premium healthcare in the society today?
Yeah, so thank you very much. So I often say that there is a trend in the country also that talks about only having big structures without specialists. Okay? One of the most important collaborations that you should look forward to, especially when you run a multi-specialist hospital, is what I call clinical collaboration. So clinical collaboration means that you are in collaboration with group of specialists. That it is not only you, okay, that makes the decision. You know, like for almost every subspecialty in Dukes, there is a minimum of 2 consultants. And you see, that brings safety. So it is not only one person that talks to you or to review your images and say, this is what I want to do. So you have to discuss over and over what approach you should use and all that. So it's a big shout out to all the consultants that are involved in the clinical collaboration in Dukes, both the full-time consultants and the local consultants that come in to see patients. That's the most important collaboration. So do we collaborate with other people? Yes. We collaborate with organized institutions to do educational programs for them to enlighten their staff. We collaborate with other specialist hospitals in areas of, on diagnostic centers, on some things that possibly we know that, this person does better. Okay, so you send your patient there to say, get this done and bring the report to us so that we interpret it. So there are a lot of collaborations going on. And of course, there are a lot more in the pipeline that we are hoping to bring on board as we continue to raise the bar of healthcare delivery in the country. Okay.
All right, sir. So you said something about diagnostic centers and diagnostics units within your hospital now. Is there a possibility for organizations out there that might be listening, watching, is there a possibility for their staff per se that are employed with them to be able to partner with you in terms of diagnostics tests that could be carried out within the hospital? Do you think that is a possibility? Do you think that is also it can be a formality that can exist between both parties?
Oh yeah. So if I get you right, partnership are always in 2 ways. You see, you partner with people and get things done through them, and they also partner with you and get things done through you. And you see, the essence of partnership is such that you can complement the workforce, and of course, by that, improving the outcome of care and intervention. So in Dukes in particular, there are a lot of things that you see, sometimes when we talk to our patient and we say it's available, they say, wow, it's available in the country. Oh, they don't know. So there are a lot of things that are available in the country, that are available in Dukes, and you can be a partner to it. You can be a partaker of it. You can benefit from it. Or even hospitals, not only individuals, other private government organizations can benefit from it. Duke's Neurosurgeon and Specialist Hospital is one of the very few hospitals in Lagos and in the country that has a dedicated neurodiagnostic lab. And when you talk about neurodiagnostic lab, you have some problems about your nerves, you can't even pinpoint where the problem is, which part of your body is really being affected. Is this coming from spinal cord? Is it coming from nerve supplying your muscles? You can walk in, you can call into the hospital and book to do nerve conduction studies. You can do electromyogram, for people that are possibly been having episodes of seizures and they are trying to check what electrical activity in the brain is having issues. You can come and do EEG, electroencephalogram. Those are available diagnostics that possibly you're not going to see in most places, in most places around us, and you keep having people that have problems with their nerves every day, trying to look for, they want to know exactly what is the problem with the nerves. So you call it. And even as a neurologist in other hospitals, as a consultant in other hospitals, you say these are opportunities for you to increase your diagnostic accuracy. You want to ensure that you do better, you get better tests for patients. And of course, like I initially told us earlier in this, that there are a lot of supportive specialties that help us to ensure that patient is actually very much well ready and prepared for surgery. Part of them is lung function test. The patient going under general anesthesia, you have to be sure that the person can handle the gases that will be given to such person. So the hospital has lung function test machines, and of course the cardiac aspect, the echocardiography, of course, is available in most places also, both for adult and pediatric patients. And of course, 24 hours, 48 hours EEG monitoring. For you just wake up suddenly, you discover your heart is palpitating and you are so aware of your heartbeat and it feels so unnatural. You should not just take it for granted. It's part of the health education we're talking about, and it's part of early presentation we talk about. Get to see a cardiologist, get to do ambulatory blood pressure monitoring, get to do your Holter ECG. All those are available. So it is not only about neurosurgery. It's not only about, we don't have. So again, don't say because you don't have it in your own particular hospital, it's not available in the country. No, it's available. So, and that is part of the health education we talk about. So this podcast is targeted towards not only the patients, not only it's for general, it's for Nigerians, both doctors, both nurses, healthcare practitioners. You are a patient, you have a relative that you think needs care and should reach out. So we'll be glad to make use of all these facilities that we'll put together in place to help. Again, I have some of our neurosurgeons colleagues that now reach out to us to say that, they have this particular patient has this particular brain tumor and they want to use the hospital facility to do that. Okay, so the purpose of this is we've tried over the years to increase the safety margins of our surgeries by buying some equipments that are not readily available or maybe not available in the country. Of course, there is what we call Cavitron ultrasonic aspirator that definitely helps you to safely remove brain tumors even from adjacent delicate structures. We possibly are the only hospital that has this in Lagos and Southwest. So we get to have a lot of people trying to come around to say, they have a patient that has complex brain tumors and we think we want to make use of your facilities to do it. Of course, basically operating microscopes, intraoperative ultrasound, intraoperative Doppler, a lot of them. We can't be mentioning everyone, but you can be rest assured that Dukes is here to raise the standard and the bar of healthcare delivery, and there is a core center of neurological care excellence, and we work every day to increase and to improve on what we are doing.
Right, so that's amazing.
That's very wonderful, seeing that we have top-notch diagnostic centers in our hospital. Now, talking about us enlightening people on neurological care. As a neurosurgeon, neurological cases are usually frightening to people. When you tell people, you're having a stroke, you have a bleed in the brain, you have a tumor in the brain, it's often scary to them. So how do you, pass down information to them without giving them false assurance? But you are trying to give them hope as well, but you don't want to give them false assurance. How do you do that?
Thank you very much, Precious. That's a very fantastic part of patient care that, you have to always hold there. And sometimes when I want to tell my patients some of these news headlines, like I call them sometimes, I tell them, I say, this is one of the most difficult things for me to do as a neurosurgeon, especially when the news are not looking too palatable. Yes. But you see, the bedrock of the practice is integrity, and you just have to be plain and empathetic. while passing this information across. There is no need to color white blue. You should be able to pass the information across genuinely, empathetically, and as much as possible professionally. Okay, so what we've done over the years and what we keep doing is that when we have patients that have brain issues, spine issues, or any other medical conditions or surgical conditions we're managing, we often try to correlate what we call the symptoms of the patient, the signs of the patient, and then correlate that with the result of investigations. And that is how you go make a complete diagnosis. And wherever you are in doubt, you should check again. Okay? So because there should be a match. Otherwise, you will end up cancelling your patient and treating your patient for a condition that you see on imaging that is not the one causing the patient problem. Okay? So counseling patients is a major thing. Sitting them down, looking at them in the face, and telling someone that I'm sorry with the headaches, with the vomiting, with the difficulty walking, and with what I have seen in examining you and your neuroimaging, this is a brain tumor. Even to you as a neurosurgeon, it may be another time for you to enter into the operating room and possibly open somebody's brain and remove the tumor. But for that patient, for his or her family, it's a major life event. So as a doctor, as a consultant, a specialist, it is appropriate for you to know that you are under that heavy burden of what is happening in the mind of your patient and the relative. Okay, so I'm trying as much as possible to see that anytime you talk to them, you put yourself in their shoes. You say you must leave the shoe of a surgeon. Okay, you leave the shoe and the position of a surgeon. You put yourself in the shoe of the patient and tell them, gentlemen, this is the diagnosis. Gentlemen, this is what we're going to do about it. These are the possible outcomes. These are the possible complications. You see, some of my patients that are possibly listening to this, they will say that, oh, this is how he talks to us in the consulting room. Because when you ask me, is this surgery safe? Is it 50-50? I tell them there is nothing like 50-50. Okay? Because even if it is only one person that has complication, that is 100% to the person. That's 100% to the family of the person. Okay? And even you removing your toenail alone has complications, possible complications. So let alone of a brain or spine surgery. Okay? So as much as possible, be open to your patient, be sincere with them, and get them to understand the details of what you want to do to them and what they should expect. You see, patient expectation should be managed, okay? And these are critical things in healthcare delivery. I'm sure with time, gradually, Nigerian healthcare landscape is improving daily. We now have more doctors that know their limits, that know the limit of their skills or the limit of their available equipment, and they are willing and ready to refer to the next patient. We get to see this a lot. We have people calling on us that, oh, he thinks this patient is having a stroke. Okay, don't worry, let's send the patient to us. Patient gets to us, we evaluate the patient. We go, okay, it's fine. It looks like a stroke, but in reality, it is not. Possibly a tumor somewhere, it's possibly an extra brain tissue bleed, and it is really not what is called stroke. Sometimes it's a neck problem, mimics like that. So those are some of the things that we have seen in practice. But you see, I must confidently tell us here, it's much better. We are in a good space, and the Nigerian healthcare system is improving per day. If you are someone that has been doubting whether there are quality healthcare delivery centers in Nigeria, this is a time for you to start changing your mind. Things are better. The inputs are better, the skill set are better, the availability of equipment are better, and we can always just be better. Okay?
Thank you very much, Sam. So it's safe to say neurosurgical emergencies is like an emotional roller coaster, because breaking the news is also not easy.
Yeah.
And also for the family and for you also as the surgeon.
Absolutely. You see, in most part of the world, Even whether emergency or elective, you get your teams together, you have sleepless nights, even for procedures that you have possibly done 1 million times. You will still want to go through it again. What are the peculiar things about this particular person? Where will I enter from? Where will I not go in from? So there is always a clinical conference meeting of surgeons and the physicians and the clinicians that are going to participate in patient care. So when patient drives into the hospital and say, oh yeah, I've come oh, yeah, this and that. Nah, it doesn't look like that. It's not as simple as that. As we are seeing you, we are also thinking of how to solve the problem. And then we're discussing amongst ourselves what's the best approach here, what could we do, how can we ensure that we minimize complications, So because you see, the best way to treat a patient is to avoid complication, avoidance of complication. A friend of mine will always say that when we counsel patients for surgery, it's just like the air hostess that is on board with you. And the air hostess is telling you that in case of crash, in case of emergency, use this. The air hostess is the surgeon. The passengers on board are the patients. Do you think the air hostess wants the plane to crash? No. But he's also telling you that in case of emergency, this is what you should do. Exactly what happens between the surgeon and the patient. There is no surgeon that wants the patient to die from his intervention. Okay. So, but of course, at the same time, you want to prepare the mind of your patient that this does happen. But of course, in this facility, in this healthcare institution, we've improved and we've increased the margin of safety by the level of the skills of our surgeons, of our doctors, and of course, the available of modern equipment.
Okay, sir. Thank you, sir. So as we come to the end of the show, I want to ask you one more question. So we talked about bringing in patients for different surgery. We talked about brain tumor removal, brain bleed removal. So what neurosurgical services are currently available at Zooks? Do you offer everything, or do you refer out, or what exactly do you people have?
Okay, great. So that's a good question. I'm sure it is also part of the health education, because knowing where to go, when to go there, and how to get there, they are essential parts of saving people, Dukes is a comprehensive neurosurgical center, by all standards, a comprehensive neurosurgical center, super clinicians, modern equipment, good support staff, 7-bedded intensive care units, and all of those are all put together to ensure high level of clinical safety for patients. So in terms of services available, we are renowned and known as the Center of Excellence for Neurological Care. We have access to do endoscopic brain surgeries, minimally invasive brain surgeries, open brain surgeries, what we call microscopic brain surgeries, either to remove blood clots, to remove brain tumors, to remove pus collections in the brain, what we call abscess, or to clip aneurysms, or to remove vascular malformations in the brain. All these are facilities that are available. Patients have come, patients have been operated, and they have very good outcome. Spine problems, difficulty walking, recalcitrant back pain, patient getting confined to wheelchair, all these are available. Acute stroke management is one area we are very renowned for, both in doing what we call clot burst therapy, if the patient comes within the acceptable hours, and either to evacuate bleed in the brain as a result of strokes. All those are facilities that are available, and these services are backed by 24 hours fully manned 7-bedded intensive care unit across our locations. So like other problems also are things around heart, lungs, abdomen, we have oncology surgeons, and they do laparoscopy surgeries, a lot of laparoscopy surgeries, laparoscopy Hellas procedure, laparoscopy cholecystectomy, appendicectomy. These are facilities that are readily available. So, and I think this should be like an introductory and an appetizer, an introductory part of this, an appetizer for you to know that, you see, look no further. Standard of healthcare in Nigeria has increased. Dukes is raising the banner, and it's just a phone call away for you to talk to people that will direct you to see different specialists. And you can get the good outcome for yourself, you can get it for your friends, you can get it for your neighbors, and you can get it for your family members. At any point you call, I'm sure the hospital system will be willing and be ready to deliver the highest standard of care possible to you.
Thank you, sir.
All right, so a lot has been said, a lot of wonderful things have been said on today's episode, and I'm sure the viewers at home might have been able to understand that neurological care and neurological healthcare delivery has been increased. The standard of neurological care has been increased today in our society, courtesy of facilities like Duke's Neurosurgery and Specialist Hospital. And with that, we come to the end of today's episode. Thank you so much. Thank you so much.
Thank you, sir.
Yeah,
Thank you for
thank
coming
you.
us today.
Thank you. See you guys next time.